Thank you, President Brimhall, Dr. Pfeiffer, Chairman Romero, esteemed faculty, staff, parents, and especially the graduates, for inviting me today to share in this most important of events in your lives, the 199th UWS commencement ceremony. While I do remember my graduation ceremony about 31 years ago at New York Chiropractic College, I couldn't for the life of me tell you the name of the commencement speaker. So I don't have any unrealistic expectations that you will remember my talk today. Yet hopefully, there will be a message or two that will strike you. And as you begin this new phase of life, maybe some of them will have some meaning. But more importantly, let me be the first, or among the first, to congratulate you on this amazing milestone. Also to your families, be very proud of what you two have done to bring these physicians to this day. To the faculty, these graduates will remember you forever. They thank you, and I thank you for giving them to the world. So what would a talk be to a group of health professionals at graduation if we didn't mention a little bit today about the Patient Protection and Affordable Care Act known as Obamacare? Recently, at a meeting I held in Hartford, I met with a man who was in charge of the insurance exchange program, those new programs in Connecticut. Ironically, he is the same man who wrote the program in Massachusetts some years ago that was actually the basis, the foundation for the Obamacare program. He said to me, among other things, that the government is looking for out-of-the-box solutions to this current healthcare crisis. And then he looked at me straight in the eyes and he said, chiropractic must be part of the answer. And then when he went on to say that we can no longer stay on the same path and expect different results. My response to him then was, we must allow this profession to be treated fairly, equally, and given a level playing field. And if he does, we will provide patients with conservative care first that will lower the costs and offer safe and effective treatment for patients who come to our offices. The question on the table then, of course, is, well, how do we create this type of parity? How do we then achieve what our goals are in our new healthcare system? And why, at a commencement speech for doctors of chiropractic, am I talking politics? A topic we hear more than enough on television, what seems almost 24/7. Well, because if you take a step back, as I have, there is an opportunity that is being handed to us for perhaps the very first time in our history as a profession. And it is ours to either seize or let slip away. Yes, it's called Obamacare. And for at least today, I ask you to try to recognize this is not about Republicans or Democrats, but rather how under this new federal law, the chiropractic profession is going to position itself to move forward in a new healthcare paradigm. Healthcare reform is here to stay and is being implemented as we speak. Any questions about its future were resolved a year ago by the Supreme Court. And in fact, the House of Representatives has attempted to appeal it over 30 times, but it has not happened yet. So we must accept that it is law, and we must prepare for it. And as you think about my comment a moment ago about the Connecticut government official, we should be looking at the government to help us do two things: to allow for free market so we can do what we do best, and to allow a level playing field. This law, the Affordable Act, actually, for our profession at least, opens up opportunity that we could have only dreamed about 5 or 10 years ago. In fact, it is nothing less than transformational for the chiropractic profession, and in fact for the patients we treat. As we sit here today, they are literally redefining the terms that have been a staple of healthcare for well over 100 years. Who is a physician? Who is a primary care provider? How are we going to pay the bills for 40 million newly insured people? What is an essential health benefit? What is a patient-centered outcome? I can assure you what it is not is a $100 aspirin, as we have seen in several exposés in hospitals. But if these provisions actually take hold, I also believe insurance companies ultimately, for the first time, will not be making the decisions on what is covered and what is not. And in my opinion, it's about time. Decision-making will shift back to the hands of researchers and the hands of clinicians. Well, why is this important? It is important because this paradigm shift for the first time offers us to prove that the work as chiropractic physicians is of equal importance to the health of this country as any other healthcare profession. Why would it be different now? Well, in the law, the American Chiropractic Association was able to insert a small little section out of the 2,400 pages, and it's called the Federal Non-Discrimination Act for Providers. It says, insurers shall not discriminate with respect to participation under the plans or coverage against any healthcare provider who is acting within their scope of practice in their state in which they practice. So in a nutshell, starting in 2014, patients of doctors of chiropractic, you, can no longer face insurance discrimination when they decide to see you in your office. It will be against the law. Also of particular importance is the field of wellness and prevention. Senator Tom Harkin from the Health Committee in the United States Senate said, and I quote, "For many years, I've been saying that we don't so much have a health care system in America as a sick care system. If you get sick, you get care. Up to the point of sickness and/or disease, you are pretty much on your own," he said. To date, wellness and prevention have been the missing pieces in the national conversation about healthcare reform. It's time to make the centerpiece of that conversation. For you, our new chiropractic physicians, in my opinion, are among the most knowledgeable professions in this country in the important work of wellness and prevention. In fact, in the Obamacare bill, thanks to Senator Harkin's work, there are over 26 sections on wellness, and there is no better professional suited than you sitting here today to be the lead clinicians in keeping and getting America healthy. Of course, the question that some of you may be asking yourself after some 20 years in school is, how do I go from being a student, to making that kind of impact in my community pretty much on my own? Good question. Can I ever really do that, maybe in your mind? You may be a bit scared. You may even wonder if you're ready. But let me assure you, over the last 30 years since I graduated, this profession's educational programs have improved to a level of quality equal to all other health professional programs. And in your school particularly, you've been prepared to not only survive, but to thrive as a conservative, naturally focused primary care chiropractic physician. Your distinctive approach to a patient will not only help them, but it will set you apart as an indispensable member in our new healthcare system. And that brings me to my advice portion of the commencement address. You know, they all have to have one. But I believe the most important areas that will impact you when you graduate after today is the concept of collaboration and integration. Doctors, it is my deepest conviction that the future of our profession is now in your hands, and the continued success of it will be in collaboration and integration with all other health professions, with the sole focus of offering the best multidisciplinary care for your patients. America is aching for health care that begins with the most conservative and natural treatment as the first-line approach. Prescription medication and surgery are very important interventions, yet there is no secret about their abuse and overuse. Just yesterday, the Mayo Clinic came out with a study that said 70% of Americans are on one prescription drug and more than 50% are on 2 or more. Over the years, since the last Iraq war, about 775,000 veterans, 35% have been prescribed narcotic painkillers such as OxyContin, and many with devastating consequences. In New York State alone, the addiction and fatality rate has more than doubled because of these medications in just 5 years. I am also quite certain that most of you read about the unfortunate meningitis deaths and illnesses related to epidural injections of the spine, in which 48 people died and 720 were treated for adverse effect. Now listen, bringing this up is not about being exploitive or opportunistic, but rather it is always appropriate to ask if safer, less invasive, conservative options were tried first. In an integrative system that includes doctors of chiropractic, at least we would have known that all conservative approaches were exhausted. In today's healthcare system, I am simply not that confident that it occurred that way. When it boils down, there are 5 pillars to the new healthcare law: evidence, quality, cost-effectiveness, safety, and access. These are what our new system will be built upon. But let me remind you about your profession and these pillars. Number 1, evidence. There are over 822 studies that have been completed that support the effectiveness of the chiropractic approach. We have been tested perhaps more than any other profession or specific treatment method. Number 2, quality. Patient satisfaction. Surveys reveal that over 90 to 94% of our patients rate us with very high marks. Cost effectiveness is perhaps the keystone to all future health care, and we have studies that show that when healthcare is initiated first line by a doctor of chiropractic, it saves between 20 and 40% of the costs if it was initiated by another provider. Safety, always important, and our treatments compared to others have minimal adverse effects. Access. Number 5, with a predicted shortage of 60,000 primary care medical providers, the army of 70,000, actually 70,055 starting today, are ready, willing, and able to act as primary care chiropractic physicians to those newly insured and most in need across our country. You see, we are all ready for you. The country is ready for you. You are ready to lead the healthcare world over the bridge to tomorrow. So are you ready to get started is the question. I know you are. But here are 5 tips that I can give you that hopefully will help your new careers begin. First and foremost, patient-centered care. You've heard the term before, make it your mantra. Patient-centered care refers to individual patient care and to being an advocate for the patients and their families. Occasionally it refers to social or even political action. But most of the time it means paying attention to the patient's needs and putting them first. The oath that you take later today will say that. Your chiropractic ethics say that. State licensing boards say that. And I have learned over the past 32 years, it's the only way to practice. Number 2, continue to use objectivity without forgetting the subjective. Chiropractic is an art grounded in science. Do your best to know the studies, the data, the pathophysiology, and try to apply them objectively. But don't forget the patient. Listen, be compassionate. Try to keep their chief concern your chief concern. The patient is first, not the doctor. Number 3, promise to ask questions, and on occasion, dare to admit, I don't know the answer. But hopefully, you will know where to find them. Additionally, you must acquire the ability to recognize when you've succeeded, even when maybe you failed for a patient as well. Number 4, communicate. Some of you probably look forward to speaking, and others just think about panic. While no one here is probably an expert at speaking, no one is going to market you like you. And you are now responsible to give the world a glimpse of who you are, so they are willing to say, I will put my health in your hands. Why should they do that, you may ask? And that's a great question, one that you had better figure out pretty soon. If you get anything from my talk today, let it be an answer to the question, why should a patient come to see you? What will you offer them to make them pick up the phone and call for an appointment? The answer is actually quite simple. You must reach out to your audience, whether it's 1 or 100, and tell them what they need and what they want to hear in an open, honest, confident fashion. Every audience, in every situation, large and small, wants one question answered. What's in it for me? Plain and simple. It may be a solution to their back or shoulder pain, or in another venue, it may be how they get rich quick. But the question is the same, and you must answer it for them. If you want them to pick up that phone, remember, they are thinking, what is in it for me? Bottom line, if you exhibit confidence and conviction and passion while communicating with them, you won't need to offer 50% off coupons. You won't need to provide free fried chicken dinners in your office. And you won't need to set up a booth in the middle of the mall down the street. People cherish their health. If you can help them retain it or obtain it, they will fill up your waiting room. If you are going to thrive, it will be done in the court of public opinion in your community. Effective communication is a one-on-one contact sport, one of the few sports where both players can be a winner. Number 5, as I finish up, promise to be involved, whether it's research, teaching, advocating, or volunteering. Remember that consumer health issues and chiropractic are often advanced and affected more by a percentage of time you spend outside of your office, supporting your organizations when called upon to do so, than inside your office. As president of the American Chiropractic Association, I certainly believe in this goal. I believe that is one you should have for yourself. Margaret Mead summed it up well when she said, never doubt what a small group of thoughtful, committed citizens can do to change the world. Indeed, it is the only thing that ever has. Our small profession must continue to press on for what is right and what is just. Millions of patients count on chiropractic's collaborative, integrative, distinctive approach to healthcare that uses conservative, natural approaches first. So today, graduates, this is it. For better or for worse, when your patients will now call you doctor, when your parents and your grandparents can rightfully brag, you are now going to view the world just a little bit differently, and the world is going to view you differently as well. But you always must keep a part of yourself the same. The part that has your morals and your values, your ethics, the part that have brought you up to this point, up on this stage today. So as you prepare to pick up your treasured diploma, let me share with you something Albert Schweitzer said to a graduating class many years ago. He said, I don't know what your destiny will be, but one thing I know is that the only ones among you who will really be happy are those who have sought and found out how to serve. But you already knew that, because that is why you chose a career whose goal is to serve others. I recognize that today is just one step in your lives and careers. The next step is yours to take. It has been said that our destinies are not in the stars, but in ourselves. Congratulations and good luck.